Thank you so much, everyone, for joining us. My name is Mannat Kaur. I'm a junior in high school, and I'm the founder of Object. And the goal of our organization is to promote confidence in young girls. I'm super excited to have Dr. Andra Blomkalns here with us today. She's the chair of emergency medicine at Stanford. Dr. Andra, thank you so much for being here. I know this is a very busy time for you. We have over 100 girls from across the country registered for the workshop. It's actually our first Zoom webinar, so I've spent the last couple of days learning the ins and outs of Zoom, but there may be some technical glitches. Today's workshop will have 3 parts. So Dr. Andra will give us an overview on COVID-19, a very timely topic. My teammate Suri afterwards will interview Dr. Andra, and she's done a great job organizing this workshop. And finally, we'll open it up to the audience for Q&A. So if you have any questions, you can type them in the Q&A box. And once we call on you, please be prepared to turn on your microphone and your camera so that you can ask Dr. Andra your question directly. So with that, once again, thank you so much, Dr. Andra, for being here, and we can get started with your slides.
Okay, great. Mannat, thank you so much for having me. I've been looking forward to this for quite some time, and it's actually a quite welcome diversion from a lot of the things I've been working on over the last couple of months. And when we get to that question and answer period, I encourage people to ask whatever they like. I'll answer any question on the planet. And I'm really impressed by this program and very much wish that I had had an opportunity to participate in something like that. So I think this is really valuable, and I feel really honored to be here. So, so my name's Andra. I am the chair of emergency medicine, and I'll just give a little bit of background about some things, and then we'll go through some slides. So one, emergency medicine is a subspecialty of medicine. So just like there are cardiologists and family practitioner doctors and obstetricians and nephrologists and those sort of things, emergency medicine is a specialty that you train for after medical school. So after college, there's a period of medical school, 4 years, and then there's an additional 4 years of training specifically in emergency medicine. I was born and raised in Louisiana and did my schooling at Texas at Rice, and then went back to LSU for medical school, and then went up to Cincinnati for residency training, not knowing a soul up there, and I thought that was the Great White North. So depending on where you guys are all calling in from, that might make you laugh or make you sad at the same time. But and I trained up there and then stayed there for a good period of time, and then came to Dallas, Texas, where Parkland is, and then very, very luckily got selected for this position here at Stanford, and I've been here for about 18 months. So I'll go ahead and share my slides and tell you a little bit about the COVID journey and what that has meant for me, both personally and within emergency medicine. I'll start off by, let's see. Actually, I didn't start off at the beginning. Of course, my fault. Okay, there we go. Talk a little bit more. Mannat, can you see my slides?
No, not yet.
Yeah. Okay, hold on. I think there's always like a little bit of a delay in there somewhere. Share screen.
It's working now.
Okay, perfect. Excellent. Thank you so much. Thank you for your patience. So I understand that there's some diversity in terms of training and how people are across and perhaps what courses they've taken so far. So I'll just briefly tell you a little bit about what is COVID-19 and kind of why it's such a big deal. So COVID-19 is actually the disease caused by the SARS-CoV virus. And viruses are particularly interesting and also scary because by the way that they work is that they attack other cells, human cells or animal cells or other cells, even plant cells, plants get viruses, then inject their DNA and tricks the cell into actually manufacturing the virus, and uses basically the body's host immune system to continue making the virus basically, doesn't even realize it's doing it. It's using its own cellular machinery to do it. So it's kind of sneaky in that regard. That's a little bit different than bacteria and how they act. So I'll just continue calling it COVID-19 and not the SARS-CoV-2 virus because it's harder to say, but just know that there's a name of the virus, the name of the disease that it causes. So COVID-19 is interesting because it's a new virus to humans. So whereas we deal with the flu all the time and the common cold virus all the time, and chicken pox, you've all probably been immunized for chicken pox. I actually had to get chicken pox, but you know, we have immunizations for a lot of viruses. Because this virus is new and actually was in animals previously, but only new to humans, likely within the last 6 months, is that it doesn't have a vaccine. And we also don't understand it completely. So when this first all started happening, we didn't understand exactly what it was, how it spread, how easily it could spread, where it even came from. So there were a lot of questions about it. And the last 3 months have been essentially learning on the job as different things would come out on almost a daily basis that we would have to kind of scrum and pivot to another way of doing things because we, the world, learned more about this virus. So in emergency medicine, we see basically unscheduled things that happen to you. So that could be sprained ankle, broken arm, weird rash, heart attack, stroke, bicycle accident, car accident, all those things. So it kind of spans everything from sometimes when people are not so sick, and then sometimes obviously when people are very, very, very sick. And we have the whole extremity of age. So we have a pediatric emergency department where we take care of, you know, 2-second-old infants and then people who are up to 102. So it's the entire spectrum of medicine. So it is very common in the winter, particularly winter months, January, February, for us to see a lot of flu. And the flu virus is also a virus, and a lot of people can get vaccinated for it. Most people do get vaccinated for it. However, the vaccine, depending on how they predicted the vaccine, works, you know, sometimes very well and sometimes not very well. So this year's vaccine was actually pretty good, but this goes into the COVID journey because COVID, we were seeing a lot of flu. And flu can present itself as cough, runny nose, sore throat, body ache, shortness of breath, all those things. And I'll tell you what I noticed initially was in February, early February, late January, that we were seeing a lot of flu, people like with flu-like symptoms coming in. And, you know, most people can manage those symptoms at home, but when they get very severe, they come to the emergency department. And we have the capacity, because the flu's been around for a while, to test for the flu. And I remember thinking, like, here's all these people who look like they have the flu, but don't test for the flu. So we would just say, well, you probably have some other virus and you'll probably get better. And here are some things you can do to make yourself feel better and go home. And I remember thinking, I was like, this is a lot of people who look like they have the flu and don't have the flu. So it was just something kind of in the back of my mind at that point. Of course, the whole COVID thing was going on in China, and we were asking some questions of people when they came in. We didn't have a test for it, really. The health department had a test, but it took several days, and they weren't really giving it out. And so pretty much the only way you could get tested, or a patient could get tested for COVID at that time, was if they had come directly from one of the countries. It started out with China, and then it slowly went to some other countries, but otherwise we had no capacity to test. And so we didn't really know if those were, we still don't know whether or not those were COVID people around or not. But it was interesting because at that point, we weren't wearing necessarily masks all the time or gowns all the time or, you know, face shields or goggles all the time. We were acting like normal. Now we're very careful with people who have the flu, but we don't get in that full outfit. And it wasn't until March, beginning of March, that we finally got a test for it and then realized it was everywhere. A lot of our patients were having it. A couple of our providers got it. Several of our providers, and I say providers, physicians and residents, were sick. And but the test still took a long time. And then we learned that at least on the West Coast, the first cases were here in Palo Alto. And now in retrospect, we know that the first deaths in the country were actually in Palo Alto way back in February. So it's scary to think, you know, we didn't know enough to know that it was even in the United States when it first came here. And this is just, you know, showing predominantly that Palo Alto in this area was a hotbed. There were other hotbeds, and that included the, sorry, my dog's barking and I'm getting distracted. She'll stop in a second, I swear. The Northwest coast, and then certainly the East Coast started clicking along, and then we know about all the catastrophes in New York and Boston, Louisiana, and other places. It's been bad pretty much everywhere. So I went from thinking, gosh, that's a lot of people with the flu who don't have the flu, to holy cow, we've got to test people outside. We can't let these people in the hospital. Hospitals are for sick people. And oftentimes the people in the hospital are very sick and susceptible to even more disease. So if you can imagine somebody who has cancer or has a bunch of other medical problems like heart disease or lung disease or even a transplant or something, that all those people are at high risk. And we didn't know really who had it, who didn't. So we developed basically a patient care area outside. And this is me on one of the first days, where we screened patients outside to see if they had any symptoms, and then took them back to swab them in an area and never left them in a hospital. And that's when we first started really using what we call PPE, or personal protection protective equipment, which includes that N95 mask, a gown, and gloves. And at that stage, we weren't even wearing goggles or face shields, but later on we did. About a week into all that, it was a Friday evening. I wasn't working that weekend, so I was super happy, and I sort of felt bad, and I kind of had a fever. And then at exactly that point, my clinical director called and said, Andra, I've got some bad news. One of the patients you saw last week is been tested for COVID and is really sick. And I remember the patient thinking, I was like, that was one of those patients that I thought had the flu and ended up not having the flu. But that meant I probably had it at that point. So I drove up to the side of the emergency department. This is one of my colleagues, Corey Poffenberger, who's awesome. And she came out, and now she's wearing a face shield. See, things change really quickly. She swabbed my nose, and fortunately I didn't. I had a different virus. But that notion all of a sudden of, holy cow, my job might make me really sick. For some reason, I always knew emergency medicine had a risk, but not necessarily. That kind of just really hit home when somebody dressed up like that, comes to your car and they won't even talk, they won't touch you, or they're wearing a mask, and what that means in terms of the gravity of having a job that can make you really sick. So the national scene got very involved, and the shelter-in-place orders started, which we recognized was pretty important. Different states did it in different ways, but that's also when we stopped. We started running out of PPE, the personal protective equipment, and the problem was that everybody was ordering it all across the country, and we'd place 6 or 7 orders for every one order that actually showed up, because there was a lot of competition for it. And that to me was really strange, to be in the United States and not be able to get these things that we took for granted. But we started having the conversations of, okay, how many times can you wear a gown? How many times can you wear a mask? What do you need to do when you go home? And I was spraying myself down with isopropyl alcohol, particularly my shoes, and going straight to the shower and putting my clothes in hot water and washing them, because I didn't really understand what we needed to do. The other thing we recognized that was really important is we've got to learn more about this virus. And the world wasn't set up to do that very well. Even Stanford didn't particularly Stanford's huge in research, and there are a lot of research organizations, And we were trying to get samples, but Stanford didn't want COVID positive people on campus because we didn't understand it. We didn't understand how it was spreading. We just knew it was bad. So one of my prouder moments is setting up this renegade research tent in the back of a deserted parking lot because everything was shelter in place. That's my assistant, Jesse. We basically had like a construction sign, and those were a couple pediatric residents who were collecting samples. And we had people who tested positive come back when we retested them and collected some of their samples so that we could proceed with innovating how we collect samples, how quickly you can get the test done, how long the virus is shed from the nose. But even our own campus wasn't welcoming of research at that time, so we had to improvise. The first time we put the tent up, other people were taking pictures of it and sending it to the news and calling the police, and it was all very interesting, but in the name of science. You know, the cases started to rise. It all started early in March, mostly because we had a test. And if you think about it, if you don't have a test, you don't have any cases. But once you have the test, you can start testing people and realizing how much trouble you're in. And that's been a theme, ladies, across the country, is that you only know how bad this thing is if you can actually measure it. And a lot of places have not been able to measure it. This is just a photo of we had to put up tents outside. We had a limited number of negative pressure rooms, which is what the CDC was recommending. But if you have over 100 people coming in a day, there's no way those 4-starred rooms were going to work. So we developed this outside. That's a heater in the middle. It looked really cool at night. It almost looked like a fancy hotel lobby, but it wasn't. It was a place to test people. I'll just skip that here for the sake of time. And then we started, you know, a lot of people needed to be tested. So we opened up our parking garage for drive-through testing. And it's sort of like if you've ever seen the NASCAR where people run out at the pit stop and do all the things and change the tires and get all the information and whatever. We would do that. Patients wouldn't have to touch anything. We took pictures of their driver's license. Everyone was dressed up in PPE. And we would test them and they'd drive off, and then we'd call them later if the result was positive. And the results would usually take over a day at that time. So it was, it was an interesting time. We've shut it down recently because we've had so few cases, but we ran that for 3 months. The other thing we learned was that we had to keep patients, COVID patients, separate from everybody else. We had to keep healthcare providers safe. And then also, but that it's really kind of scary to have all your care providers showing up in all this garb and masks and goggles and things. And I encountered that myself with my own testing. It kind of makes you feel terrible. I don't know if you can sort of think that you can have something so bad that makes everybody around you dress up like that. So Ryan, who's pictured at the bottom, got the idea to use iPads to communicate with patients in the room so they could actually see a doctor or nurse's face and talk to them. Now, of course, when you had to touch them and get things from them, you had to dress up, but at least the patient could see something that was a little bit more friendly than the goon in a mask. We did some really kind of cool innovations. We did x-rays through the glass. We'd never done that before. We always had the x-ray go right up to the person and do that, but the actual x-ray machine was outside the glass. And we were just trying to minimize exposure because every time somebody walked into that room, we used up more PPE. We didn't have PPE to spare. We had to start decontaminating everything over and over again. And you can see from all the nooks and crannies on the ultrasound machine on the left how difficult it might be to decontaminate that. So we moved to an iPhone or a smartphone based ultrasound machine that was easier to wipe down with sanitation wipes. I'm almost at the end here. So, so lots of, you know, the way we battle this virus next time, or the next virus, is by learning about this one. And eventually a bunch of different research projects started, both from sampling to how do we predict which patients are going to get very sick. And now we're in the treatment phase, and we have 3 or 4 kind of research treatments that we're trying to see how they work. Right now, we don't have a lot of cases, but we suspect that they will pick up again in the fall. We've had to test all our healthcare workers because we know now people can be asymptomatic, and we've had to test 13,000 healthcare workers. And unfortunately, very, very few were positive. It was less than 2%, 1.2% positive. What we're battling now in these phases is that people are afraid to come to the hospital. And we're seeing people have strokes and heart attacks and things at home, or not coming to the emergency department for things that they would normally come to the emergency department for. So the hospital is half empty. The emergency department is half empty. And we're trying very hard to convince people that we now know how to stay safe. We know how to keep patients safe. We know how to keep healthcare providers safe. And so please come back for your emergency, because there are many emergencies like strokes and heart attacks that you can completely reverse if you get to people in time. But if you don't, then the damage is already done. So this is just a closing photo of a lot of my team in different stages of PPE and otherwise. I'm really proud of all of them. People adapted really quickly. A couple of my providers got it pretty significant, pretty badly, and one of them had a tough time just mentally realizing that he brought it home to his wife and children. Fortunately, they did not get it, but he had a tough go of it. They're both completely cured and back at work and happy to be there. But we were spared having a lot of providers actually have it. And with that, I'll close. Thank you for letting me share my journey in that regard, and I'm happy to answer any questions or whatever's next.
Wow, that is amazing. Thank you so much for sharing your story. I do have a couple follow-up questions for you, but I want to introduce myself first. My name is Suri Mackey, and I'm an 8th grader from the Bay Area. I'm actually on the Youth Advisory Board for Object. And so my first question for you is, what does a day look like in your life during the pandemic? Like an average day, what do you normally do when you go to work?
So I will disappoint you guys and have to say that most of the time I actually don't see patients, because I am chief of the emergency department. So I'll get up, I will have a couple Zoom phone calls with the dean and the rest of the chairs and the hospital leadership to see how many people we have in the hospital, how sick they are, how many healthcare providers have it, any changes we need to make to that day, what our PPE status is, anything we've learned from around the country, and then sort of commence on the rest of the day and continue to feed each other information through the course of that day. And there's about 20 people on that phone call, and it's sort of administrators of the hospital and the different departments. Then I might go check on my team in the emergency department, and in both the pediatric and the ED adult emergency department, and kind of swing through and talk to people. What's been interesting and strange is that we've not been able to connect or really have our usual, get-togethers from time to time. So I felt it was, number one, I felt it was important that people realized I wasn't scared of it, so I wasn't scared to go in the building, and that I was also willing to work. So twice a week, I actually work in the ED seeing patients. And then probably a good chunk of the afternoon is based on getting research information and so forth. And then a few more phone calls at night, and then with my executive team, and then the whole thing starts all over at 6 o'clock the next morning.
Wow, so it's very important to keep all of the medical workers safe, I assume. So can you touch on the importance of proper sanitation and personal protective equipment, not only for medical workers, but citizens as well?
Yeah, I mean, I didn't hear the last part of your question. You said not only medical workers, but
just like citizens, like it's.
Oh yeah, so we learned a lot about this virus, and we learned that you can protect yourself. And we started masking all patients, regardless of whether or not they had symptoms, and that's what the mask is for. The mask doesn't help the person not get the virus as much as it helps the virus that they might have not affect other people. So if everyone is wearing a mask, it's actually a pretty good preventative of people getting, spreading the virus, at least publicly. Now, if you're actually getting samples and looking in somebody's nose or doing something in the back of their throat, you need to wear extra stuff because people cough and sneeze and whatnot. And that's where the gowns and the goggles and the gloves come from. But you can do a lot just by wearing a mask and trying to stay 6 feet away from people. And we know that now very definitively because at least this area has done fairly well because the shelter-in-place order was put in early. And I feel very, very lucky that that happened because I think we were a couple days from becoming a New York, and we just got in the nick of time and had people start staying away from each other.
Interesting. So a lot of people are wondering what the next best steps are in order to normalize life. And so being a doctor, what important steps do you think are, what important things are society going to need to do?
So I think it's the staged reopening of things and sort of a slow reopening and seeing the effects of it. I'm not sure we'll ever get back to completely what people consider normal, or it's going to take, I would say, several years because we're still learning about the virus. And this whole first year, we're going to continue learning about the virus. And we'll learn here in the fall and the winter how badly it comes back based on how much different areas open up and start letting people do what they're doing. I think what's important as a country is that we maintain that vigor. Sure, it's inconvenient and it's sad people can't go to graduations and weddings and funerals for that matter and things, but it's part of a long-term solution, and it's absolutely necessary or we're going to lose control of this again. And so I think we just need to be careful and smart and realize that the inconvenience now is to preserve disaster later.
Okay. We all know that the media is playing a very important role in what everyone's learning about and what everyone's hearing about the coronavirus. So do you think that the media is misleading society with the information that they're putting out there, like the lack of PPE or the number of cases?
No, I actually have felt that the media has been pretty spot on. I haven't had, I've had the opportunity to be interviewed and from more media channels than I can even figure out. And that's another thing during the day. Like the press office will just call and say, "Can you speak to ABC News in 5 minutes?" And I'll be like, "Yes." So it just, those things happen very quickly. I do think initially things were a little overstated. But in the retrospect, I don't think that was a bad thing because we had to get the country's attention, and we had to get it from attention from a local government standpoint because we weren't able to get national attention to it. So even though initially I was a little, quite frankly, angry that some of my quotes were taken a little out of context and made more sensational, I'm actually glad now because maybe that helped things move a little bit faster. But overall, the statistics are statistics. If you can only test so many people and have so many positives. I don't see how that could be misleading. How it's interpreted might be misleading, but the statistics themselves stand. Okay,
to wrap up our interview session, I have two questions that I would like to ask you. So what role has confidence played in your success as a emergency someone in emergency medicine?
So, when I was in medical school trying to figure out what I wanted to do, you have to decide somewhere in the third, early fourth year what you want to be when you finish medical school and what sort of training you have to go into. And I remember I was on a trauma rotation and we were down in the emergency department, and I was a med student, and the place was just, they had like car accidents and a gunshot wound and a bunch of people who were super sick and all kinds of stuff was happening. And there was this human standing there who just seemed to have control over everything and wasn't upset. And there were people screaming and it was just a mess. And I remember thinking, gosh, I'm not that person right now, but I'd love to be that person. I'm an introvert, actually a huge introvert. Every test they ever had, I'm an introvert. I force myself to be an extrovert sometimes for my job and otherwise. But I largely chose emergency medicine because I wanted to become the person who could just handle chaos and not get rattled by things. And to some degree that's worked, but I do think confidence can be cultivated and sometimes forced if necessary, but certainly something that can be learned over time.
Okay, and our last question for you is, what advice would you give to girls that want to follow in your footsteps of pursuing emergency medicine?
Work your butt off in school. Take advantage of opportunities like this to get involved and get in. It doesn't have to be this organization or other thing, but something that's really meaningful to you, and get really involved in whatever that is. Because it also helps make you happier too, if you can influence others through your work. You know, and I would say people should choose what they feel like they have an aptitude for and what interests them. I am very interested also in the science of medicine and how to advance that science and how to innovate using technology and otherwise. So that's actually what drew me to emergency medicine, and not as much the helicopter gunshot wound stuff that attracts some other people. So, but I think it's really taking a look at yourself and deciding what you feel good doing, and not just what other people say, or your parents or grandparents or friends or something like that. You have to really judge yourself, what you're good at and what you'd like to do for the rest of your life. It's a long time. So.
All right, so I think we're going to jump into our Q&A session. So I believe that Giselle is our first girl that can ask the question. Oh, someone should be promoted right now. Giselle, you can go ahead and unmute yourself.
Hello, my name is Giselle Toth. I am another member of the Youth Advisory Board, and I have a quick question for you. So, talking about treatment right now in the coronavirus, what do you think our plans are with a vaccine? How do you think we are in progress of that?
So there has been some progress made. I think we're a year away from a publicly available vaccine, maybe a little less, 9 months to a year. It takes a while to develop a good vaccine, and we see that it's not an easy thing to do, because they have to develop a new one for the flu every year. So, I mean, that's pretty much the thing that will change and maybe get us back to something that looked like normal, is that vaccine. So so many people are working on that thing that hopefully somebody will make a breakthrough, and they will. It just takes a little time, because it has to do with understanding the immunity of the virus and testing people who've had it and trying to figure that out. So I'd say a year from now, we'll probably have a vaccine, and maybe some of that's a little bit of wishful thinking, but I hope that we have a vaccine and a real tool against this virus at that time.
Okay, thank you so much.
All right, before I choose the next person, I would encourage everyone to type a question into the Q&A section. And I believe our next person is Betty. So she should be promoted. And Betty, you can go ahead and unmute yourself.
Hi, my name is Betty, and I'm another person on the Youth Advisory Board. And one of my questions is, what is one thing that the pandemic has taught you as a doctor?
One thing, I have to pick one thing. That's a great question. That we learn a lot of stuff in medicine and medical school and otherwise, but it was a very harsh reminder, or harsh learning, that we don't know everything. And we think we might know a lot about science and all the risks and potential benefits or otherwise, but there's something new always around and always there. This time it was something we couldn't see and something that was pretty aggressive, but just sort of the humbling notion that we don't know everything. We don't know everything about medicine or science or otherwise, and the need to continue learning and be questioning and be curious is really important.
I have another question. What is an advice you would give to people who are still not social distancing?
Wow. What I want to do is somehow socially distance myself and shake them. And I'd say some pretty choice words. That's what I'd want to do. Would be more professional to do would be to try to understand why people aren't social distancing. It's sometimes it's because they don't understand why that's necessary, or they just need an explanation. I don't think anybody responds very well when you say you should X, unless they understand why there's a reason to it. And the professional and kind side of me would try to understand what those barriers were and try to explain those barriers. The inside of me is filled with rage when I see people who are not socially distancing, and I think they're stupid, but like genuinely stupid, like not just stupid, nanny boo boo, you're stupid, but like they're not cognitively working this through the way they should. So sorry, I feel very passionately about that, but that's, but I'd have a measured approach in person, so.
Okay, thank you.
Thank you so much, Betty. Next, I believe Leslie Robertson, you're up. You should be promoted, and then you can unmute yourself. Hold on, here we're having some technical difficulties.
Do you want me to pick questions from the chat and just start answering them?
Hold on, we have another person. So Naya Dayal, you can actually go up. You'll be promoted. You can unmute yourself. Naya, can you hear me?
No worries, we can just read Naya's question out loud. So she was wondering, in a doctor's point of view, how do you think that society is dealing with the pandemic?
I guess it depends on which society you're talking about, and we'll presume the United States, although, you know, it was my personal opinion, we could have done this better. And I'm just going to refer to the United States at this time. I don't know to what degree we have an international contingent here. We knew more. I feel like we didn't act quite fast enough in terms of social distancing and understanding things. And there were a lot of people jumping around screaming in February, saying, we need to get this, we need to get this. And people were very resistant, because in general, people are very resistant to change. And it was like mid-February that I told my faculty and residents that they can't travel anymore. But there wasn't a lot of evidence. So I was like, and there was a big conference in New York that weekend. And I was like the world's most hated person. In retrospect, it was the right decision, but it wasn't easy at the time because not everybody, we didn't understand the risks. I feel like we could have all acted within the medical profession a little sooner and not maybe be where we are now and not had the devastating consequences that it did in some areas.
All right, thank you. Our next question is going to be from Naomi. She will be promoted. And Naomi, you can go ahead and unmute yourself.
Yeah, so you were talking about like traveling and staying at home. So my family has always been a traveling family. We love to go everywhere. So when do you think like this thing will come to like slowing down, and when we can almost like travel and have the same life that we did before?
So it already is slowing down. We're still having new cases in the United States and even around here, but the number of new cases is decreasing, and the number of deaths per day is decreasing. I feel as though travel will be changed forever in some ways.
Yeah.
I feel like that universal masking is going to become commonplace, and just like 9/11, which you guys probably just have read about, not know about, changed how we traveled overnight. It used to be that your family and stuff could just go all the way to the gate and wave you goodbye at the gate, as opposed to having to go through TSA and all those things. So that changed travel forever. I think this is to some degree going to change travel forever. And but I suspect, I mean, I myself, I'm flying my parents in a week. Now they are going to be clad with masks and hoods and more Santa wipes and Purell than anybody on the planet when they go. But I think people have to be, well, I'm trying to get to the, it's going to be a while till things are close to normal, but I think by this winter, if we don't see a catastrophic increase, that people will be able to resume normal-ish travel in fall and winter. But it all depends on the next couple months. And we'll know a lot more in the next couple months is, can we truly start getting rid of this virus in this country? Or if you look in those statistics and if you Google like where it is, we're still covered in it. And we're just not, I think we haven't gotten enough control of it to be able to make some of those decisions.
Thank you.
Sorry about that. I was on mute. Next up is Audrey Sanchez. Okay, perfect.
Do you think anything's gonna go back to normal, like completely normal?
I'll ask you a question back in a second. What to you means normal? Like, what would be normal for you?
Like being able to go back to school without masks.
Not for a while. Not for a couple of years. I don't mean to say that to bum anybody out or otherwise. I just I'm going to go back to my statement that the next couple months will be very telling, and we'll know a lot more about what to do. We have all recognized that school and people being at school is very important, and as delightful as Zoom meetings can be, they don't substitute for human interaction. So I think school will resume, and this is just, I'm just predicting, I'm guessing really. Sometime, probably most schools will be open in the year 2021, but I don't see a whole lot of community engagement sort of schools opening up in the rest of 2020.
I have one more question.
I couldn't hear that question.
Do you think, how long do you think it will be until we're not social distancing anymore?
Probably about the same amount of time. I would say maybe until the end of the new year, or at the time of New Year's Eve or Christmas. The thing is though, if we see that the virus is starting to come back during that time period, let's say around Thanksgiving or otherwise, we're gonna have to go backwards and start social distancing again. So it's, anything at this point, ladies, is a guess. And I hope I'm wrong and we're all back to normal by the end of the summer. However, I just don't see that happening, because we already know that in some communities where either social distancing is a little lax or been removed, they're already seeing almost an immediate spike in cases. Now, none of it's as bad as it was before, but we're learning that if you don't abide by things and misbehave a little bit, the virus takes advantage of it and will come back. So I'm guessing. So I'll guess that by the time that you guys have to write 2021 down and get used to writing 2021 instead of 2020, that hopefully will be at some semblance of normal.
Okay, thank you.
Thank you, Audrey.
Thank you. Do you mind if we ask a couple more questions?
You can ask me questions all day long. Maybe not all day, but for a long time. Yeah. So.
All right. So next up we have Elizabeth Austin. You should be promoted, and then you can unmute yourself.
Okay. Hi.
Hi.
So my question was, I was just wondering about how I heard that like wearing masks is really important. Like I was just wondering if there was like a statistic about how much it will like decrease your chance of getting the virus.
Well, what we think is that actually wearing the mask doesn't keep you from getting the virus. And I want to mention there, just because I can see what you're doing, ladies, think about what you're doing right now, and if you're touching your face, stop, because that is actually something that you can do to stop. And I'm a face toucher too. I can't stand, and that is something you can do to actually prevent yourself from getting the virus. And people naturally touch their faces. The purpose of the mask is to keep other people from getting what might be your virus. Mm-hmm. Now, and that's when you are within 6 feet of one another, which happens quite often. And the reason for that is that the virus travels in droplets. So it can't travel across the room. It can't fly to the next house. It actually still gets circulated out in airplane air. It's a pretty heavy droplet. So it has a tough time, unless somebody actively coughs on top of you. It can't make it more than 6 feet. It falls on the ground. Mm-hmm. So if you stay 6 feet or more from people and avoid touching your face, that's actually a pretty good protector right there. And sanitizing your surroundings with alcohol or like Lysol wipes or otherwise, or things that are frequently touched, like doorknobs and light switches and that kind of thing, phones and keys, that those can protect you as well. I believe your question had something to do if you were hanging out with friends, how much does the mask decrease? Honestly, if I was hanging out with friends, I'm usually eating or drinking something. So we would just stay, and we've done this already, stay roughly 6 feet apart. And it's really hard to eat and drink with a mask. And it's really inconvenient. So, and that's what I'm doing currently. But I do think if you're in public, or less than 6 feet away from people, you should be wearing a mask. And they require masks on campus now, in the hospital and otherwise. So if you're out and about, you should be wearing a mask.
Is there any mask that you can wear though that will help you not inhale somebody else's virus? Like would the N95 prevent?
Yeah, it's so it could. And obviously that's what healthcare providers do, because they're getting closer.
Yeah.
They're getting really close to somebody that has the virus and getting secretions and that sort of thing. I don't know if one is wearing a properly fitted N95 mask, it is hard to breathe. It is really uncomfortable and hard to breathe. To the extent that I consider myself pretty fit and I have a tough time walking up a flight of stairs. So I think a lot of people are wearing N95 masks and not wearing them correctly, which probably reminds you not to touch your face in some ways. I'm like normally rub my lip when I'm nervous, and you can't get to your lip through a mask. So it reminds you like, oh, I shouldn't touch my face. But in terms of, yes, it could protect you, but if you're really wearing the right one, it is really hard to breathe in that thing. And I don't think most people are wearing it the right way.
Okay, thank you guys so much. We have one last question, and that's from Isla and Raya Sani. You should be promoted, and you can turn, yeah, perfect.
Hi there.
You
I'm
have
going to ask for her because suddenly she got shy.
That's okay. I'm shy by nature myself, so.
It was just, which country do you think has been doing a good job with this, and why?
I think the countries that shut their borders and did social distancing early did the best. So Singapore did a good job, a great job. Germany did a great job. But it also ends up being smaller countries, right? Because it's really hard to shut down the entire United States. And it also isn't politically a nice thing to do either. And to some degree, New Zealand, because it's an island nation. So the island-ish nations and smaller nations were able to basically shut things down a little bit quicker. And Singapore, and I've been to Singapore, the public there pays attention. And if they're told to shelter in place, they're sheltering in place. They're not, I mean, they're gonna go to the letter of the law. And so therefore you have to have both a country and a local government that's willing to put the shelter in place orders in, and then also people who are willing to abide by them. So the combination of those two are successful to other countries.
Thank you.
Thank you so much.
Thank you, Isla.
All right, that should wrap up our interview and question answer session. Thank you so much, Dr. Blomkalns, for sharing your story and answering questions.
Well, thank you so much for having me. This has really meant a lot to me that you guys asked me to do this, and I'm really impressed with this program. I'm happy to come back anytime if you'd like, just to be part of it, if nothing else. But there are a lot of insightful questions and very well orchestrated, so I'm super, super impressed. So, and Manat, you can distribute my contact information if you'd like to the attendees of these calls. And I might not be able to answer your email like right away, but I'll get to it eventually, I promise. So if you were unable to ask a question or otherwise, we'll figure out a way to get you that answer.
Definitely. Thank you so much, Dr. Blomkalns, for being so open and honest with us today. This was absolutely wonderful. Thank you to all the attendees for joining. So this is actually our last workshop of the academic year, and we will start again in September, hopefully in person, but maybe virtually as well. And so thank you everyone for a wonderful season, and thank you once again, Dr. Blomkalns, for joining us today.
Thank you for having me. Stay safe, guys. Take care.